Steve Kelly here with AZ Health Insurance Brokers. Today I want to talk about a health plan offered by UnitedHealthcare called Surest, designed primarily to do two things. Number one, have no deductibles or coinsurance. Number two, have cost transparency. You want to know exactly what it's going to cost you when you go to a provider. This plan will offer that to you. Now let's go through some frequently asked questions. Surest is an ACA-compliant health plan offered by UnitedHealthcare. At the moment, it is designed for 51 or more employees, designed for self-funded groups or fully insured groups of that size. The main benefit of the Surest plan really is this: a copay-only plan, designed with an out-of-pocket max for your plan, but at the same time allowing you to go to a provider knowing exactly what your cost is going to be. Part of the logic behind Surest is to steer members to providers that are more effective. The Surest platform is really designed around data, and UnitedHealthcare is taking provider data, and really what they're really using is how effective is a provider at solving your issue. What Surest is going to do is actually look at the data of those providers, see what doctor or facility has been best at providing the best outcome for patients, and they're actually going to make that cost cheaper for you to go to that facility. And so what happens is you end up with potentially the best doctor and potentially the best outcome for the lowest cost. The Surest plan is absolutely not designed as a bait and switch program where you see zero deductible, but then you get massive bills elsewhere. So it is a copay plan designed with an out-of-pocket maximum. So you are going to have a plan that's going to have an out-of-pocket maximum just like any other plan has with a deductible. But every time you see a provider or get a procedure, you're going to have a copay. But you're going to know exactly what it's going to cost you every single time. The simple answer is this: a Surest app. We live in a digital era. Go on your phone, log into your app. You're going to see a number of providers for whatever you're looking for, whether it's mental health, a specialist, whether it's an MRI, etc. There's going to be pricing from highest to lowest. So the entire program of Surest is really designed around providing you cost transparency, providing you the best outcomes at the lowest price. By doing so, you win as a consumer, and the healthcare company spends less money on your coverage. With the Surest platform, the copay that you see once you log into this app is the only payment that you will make. You're not going to get a bill from an anesthesiologist. You're not going to get a facility bill. It is simply designed to give you a copay upfront, total transparency, and that's it. You can go in the app. There's going to be copays based on out-of-network providers, similar to the in-network. However, the major difference is this: you can and you should expect to get a bill from, example, an anesthesiologist or a facility or anything like that. You can absolutely get balanced billed. Remember, this entire program is designed around historical data that UnitedHealthcare has, steering and directing you to what they deem as the best provider for what you have going on. Medical trend right now is showing about 10 to 12% increase on a yearly basis on your medical insurance. The Surest plan is designed to help you find that provider the first time, utilize your insurance better, get better outcomes, and reduce your overall medical trend year over year. You absolutely can offer Surest along with, say, an HSA plan, for example. Remember, UnitedHealthcare is fully aware that educating employees and educating employers on this platform is going to take some time. I like to say in the business, we walk before we run. So let's offer a Surest platform plan. Maybe you want to have an HSA plan. Maybe you want to offer some of the traditional copay plans. Offer all three. Over time, when employees get more and more comfortable and you get more and more comfortable with the Surest platform, maybe we roll some more employees and push them and steer them, if you will, toward that plan. UnitedHealthcare itself offers this plan to their own employees. Now, that being said, the barrier to entry, I think, in any new program, especially in health insurance, is going to be education. If you think and you feel that your team is willing to work with your employees and your employees want to own their healthcare a bit, and you have employees that are all on their phones, everyone can win here. We can control cost, the employee can save money, and the employer can save money. We would recommend giving us a call. We're happy to do a full benefits audit with you. We're happy to discuss and answer any other questions about this platform. What we don't want to do is just put you in a platform that doesn't make sense as a solution. We want to provide you a solution that makes sense. We think this solution is one of the best solutions out there, again, for thinking about the long-term trend cost and bringing those costs down. So give us a call.